So it was like this, and I was lying on my side, and when I went up, it hit that, and it just...
Like a reflex.
Yeah. And when I explained or described that, I had to do it twice, and then I literally had to pull it away. It was like a gripped thing, or I didn't understand that, but when I explained that to Dr. Jones, he said, I have never heard a better description of what happens. I don't know if he said when you have a stroke or in a situation like this, and he looked at the nurse and said, have you? And she just shook her head no, but stroke never entered my mind. And so not long after that, I got up, and when I got out of the bed, I fell beside my bed. And I just thought well, I'm weak this morning. I wasn't dizzy, the room wasn't spinning, or any of that. I was able to push myself up from all fours and sort of pull myself back up to the bed. And then somehow I tried to dress for work, but I thought I was dressing for work, but apparently I was not very well dressed for work. Then I went to the bathroom, and then I went to walked to the kitchen, took my morning meds, which almost sounds like automatic pilot. I don't know how I did that. Walked into my den to go to work, go out the front door to work, and fell again. And fell numerous times, trying to pull myself up by a table right there, and couldn't do it, and kept banging myself against it, but didn't realize it because I wasn't feeling any of the knocks and pains to my left side. But a handyman who came to clean the gutters at my house saw me through my front window and saw that I could not get up and was calling to me, can I help you? And when he saw that I couldn't respond, he went across the street and got my neighbor, Donna, who is a nurse here at Baptist, and that in itself is a miracle that Aubrey was there unscheduled, saw me through the front window, that he went across and got Donna, who is a nurse, who came over and immediately saw what was going on. And
so we all were home, and Aubrey knocked on our door and said that the neighbor across the street was on the floor and could not get up. I grabbed my cell phone. I told my children to go get my husband. I called 911. We looked for a way to get into the house. Everything was locked up. My husband was looking for, some way to bust into a window or something. In the meantime, Doris was able to crawl to the door and actually open it. And I went in. She was very disheveled. Her clothes were on inside out. She attempted to get up, kind of leaning on her left side, and fell over. And I just encouraged her not to try to get up, and asked her to squeeze my fingers on both sides. She was unable to grip me at all on her left side. I asked her to look up at me and smile, and one side of her mouth went up and the other side went down. I knew that we were potentially dealing with a stroke problem, but I kept assessing the situation. I asked her if she had to be at work that morning, and she said yes. And I said, well, do you know their number? And she pointed to her cell phone, which was across the way in a chair. So I retrieved that for her and brought it back. And she just kept staring at it like she didn't really know what to do with it. And then she started just kind of randomly punching different buttons on the cell phone. As she was looking at it and staring at it, she started drooling. And one of her eyes looked slightly dilated to me. My husband was standing in the road to kind of wave down the AMR as they came. And when they pulled up, I told them, we've got a stroke victim in here. And they did, of course, some of the same assessment tools. And asked her which hospital she wanted to go to. And she said Baptist, even though that was not apparently where many of her doctors are located. And as I understand it from there, Baptist was prepared on stroke alert and wheeled her directly into the ICU room where Dr. Jones was waiting.
Well, some of the things that Donna just described, I even now have no memory of, about my cell phone or about gripping the hands. I just don't have a memory of that now. And when I got to ICU, Dr. Jones told me that I had tied the record for getting to my bed, from the door to my bed, in like 37 minutes, which he said was unbelievable. And all of that was important, that everything happened like it did. But like I said, it really wasn't anything I did. I was not really, I guess, I mean, even though I have AFib, I was not mentally prepared to think about I'm having a stroke, with even my left hand or arm numb. Medication keeps me regulated, but apparently my heart went into AFib and threw a clot to my brain, and that's what happened. It was a small clot apparently, but it was a clot in my brain, and the medication I was given, the shot I was given, diffused that. So, it was Aubrey who found me and Donna who called 911, and then the emergency personnel who got me here. I had a room before I got here. I could hear them on the radio, so I was never really unconscious, but I could hear them on the radio saying we need a bed, and then saying, okay, we have a bed, 105 or something like that. And I thought, wow, I have a bed and I'm not even there yet, I was thinking about all those things. But Dr. Jones interviewed me about the clot buster medication, the shot that he could give, trying to determine exactly when the stroke occurred. And based on what I could remember and what I could tell him, he felt like that it was within that 3-hour window. And I had to sign a release, which I did, and they gave me that. And I would say, I don't know for sure, but I would say within 2 to 3 hours, if that long, there was a complete turnaround. And as far as my usage, I was constantly counting fingers and raising my legs and raising my arms for the nurses that were there. And they were all a part of that the stroke trauma team here at Baptist. Within, I guess, the 24 hours, I was moved to another room. There had been a speech therapist, occupational, physical therapist, I'm not sure who else, who were in and out of the room, asking me to do these different, follow these different requests, which I was doing as best as I could. Apparently at first, I wasn't doing that well with all of it. Dr. Jones said my right eye was also affected, but things had improved so much that I was moved to another room. And then again, the physical therapist, the speech therapist came to evaluate me, came by to see me, and each one of them said, well, you don't need me. You don't need me. You're doing great. And I myself was amazed that the next morning I was able to get up, walk to the bathroom, stand in front of the sink, and give myself a bath without being tired. I just thought, I can't believe I'm doing this. And so it's a series of events that I just attribute to the hand of God. There were those medical people, and Dr. Jones was absolutely wonderfully attentive, and all the nurses were too. But had Aubrey not come, I live alone, and so I would have been on the floor all day. Work would probably have called at some point when I didn't show up, but I don't know that I could have answered the phone. So I would be dead, or at least severely physically impaired. And I was able to leave the hospital, I think in 3 days, about 3 days, with no deficiencies and with no at-home care other than an injection that was to help build up my blood level, because I was on Coumadin.
This event had happened to Doris on a Friday morning, and by Wednesday morning she was back home. and called me thanking us profusely for saving her life. And I said, well, Doris, you've got to understand that this was God having the right people in the right place at the right time. And everything just lined up perfectly for her to be taken care of in a crucial little time window where she could get the help that she needed. And she was back home Wednesday with absolutely no side effects whatsoever, walking and talking normally, which just shows you how quickly this medicine can work if you get it within the right time frame.